talking about tests now that have things to do with like maybe hip dislocation or maybe even a fracture. Maybe it's a kid and they have a fracture of the epiphyseal plate. Maybe they other tests that we're going to do too, maybe a fracture in the femur, the tibia, the talus, or the calcaneus. And so two of these tests, we're going to look for to see if there's a hip dislocation, or maybe there's a fracture at the growth plate. And so this is called Alice's test. We're going to bring the patient's legs up. We're going to make sure their feet are nice and even. Once their feet are nice and even, we're going to look at the height of the patient's knees to see if there's any difference. We can look from this direction here. You always want to look from two different directions. So you're going to look side to side, see if there's a difference. Then you want to look from the head of the patient to see if there's any difference in the height. So again, that could tell us that we have a dislocated hip, slip capital femoral epiphysis, or something else, maybe a tibial length discrepancy, that something's causing that. Maybe it's congenital, maybe it is some type of something that's been a little more traumatic. Next test we're going to do is we're going to do a test called the anvil test. So if we suspect that the patient has some type of a fracture, now we're not talking about something that's totally fractured and dislocated and et cetera. We're talking about a fracture within the bone that's not very obvious to the naked eye. And so what we're going to do is we're going to take the patient's leg and we're going to raise it up. Now you want to raise it up so that you can take the knee into full extension. Then what we're going to do is keep the foot kind of not perfectly, we don't want it plantar flexed. And then all I'm going to do is I'm going to bob pretty good right down here on the calcaneus. And we're going to send that force up through that kinetic chain, and the patient will be able to tell us where there's pain, and they'll be able to pinpoint it pretty well if there's a fracture.